Hello, everyone. I'm Dr. Yende. Today, I want to talk about a disease that affects millions of women around the world: breast cancer. Most of us have heard the statistic: about 1 in 8 women will develop breast cancer in her lifetime. Every year, tens of thousands of women lose their lives to this disease. And yet, despite decades of awareness campaigns, screening programs, and medical progress, many women are still unsure about a very basic question. When should I start screening? How often should I screen? And what kind of screening is right for me? The challenge is that medicine often gives recommendations to populations, not to individuals, but individuals are not populations, and the future of medicine is moving toward personalization. Today, we're going beyond the mammogram. We're looking at a smarter approach to breast cancer screening, one that takes into account risk, genetics, breast density, family history, lifestyle, technology, and most importantly, you. Let's start with an uncomfortable truth. Not all breast cancers are the same. Some grow slowly, some are aggressive, some stay localized for years, others spread quickly. That means a screening strategy that works well for one woman may be completely wrong for another, and that is why one-size-fits-all medicine is gradually giving way to precision medicine. Now here's the good news: breast cancer screening works very well. Women who take part in regular screening programs are far less likely to die from breast cancer than women who do not. Why? Because cancers found through screening are often detected before symptoms appear, before they spread, and before they become harder to treat. Earlier detection usually means more treatment options and better outcomes. So, if screening is so effective, why are so many women still dying from breast cancer? Part of the answer is biology. Some cancers are difficult to detect even with excellent screening systems, but another part of the answer is surprisingly simple. Many women are not being screened, or they are not getting the right screening for their individual level of risk. That brings us to the central idea of today's discussion: risk-based screening. Instead of asking, what does the average woman need, we should ask, what does this woman need? Because breast cancer risk can vary enormously from one person to another. Let's talk about risk. Age is the most important risk factor. Breast cancer becomes more common as women get older. Most diagnoses occur after age 40, but age is only one part of the picture. Family history matters. Genetics matter. Lifestyle matters. Hormonal history matters. And so does breast density. A lot. Many people have heard about BRCA mutations. These genetic changes can significantly increase breast cancer risk. A woman with a BRCA mutation may have a lifetime risk several times higher than the average population. But genetics are only part of the story. Most women who develop breast cancer do not have a BRCA mutation. So risk assessment has to go beyond genetics alone. Family history is another major factor. Did your mother have breast cancer, your sister, more than one relative? Were any of the cancers diagnosed at a young age? These clues help doctors estimate inherited risk. But women without a family history can still develop breast cancer. So no family history does not mean no risk. Then there's breast density. And this may be one of the most overlooked risk factors in modern medicine. Dense breast tissue does two things. First, it increases breast cancer risk. Second, it makes mammograms less effective. Why? Because both dense tissue and tumors appear white on mammograms. It's like trying to find a snowball in a snowstorm. The cancer becomes harder to see. In fact, about half of women who undergo screening have dense breasts, and younger women are even more likely to have dense tissue. Yet many women don't know whether they have dense breasts until screening begins. That information alone can influence future screening decisions. Now let's talk about formal risk assessment. Instead of guessing your risk, instead of relying on internet searches, instead of assuming you're safe because no one in your family has had breast cancer, there are validated medical tools that can estimate risk. These calculators combine genetics, family history, breast density, hormonal factors, and other variables. The result is a more accurate picture of your personal risk. In my view, every woman should understand her risk profile long before age 40. Not because every woman needs aggressive screening, but because some women may benefit greatly from earlier intervention. Knowledge creates options, and options create opportunity. Now let's talk about mammograms, because when most people think about breast cancer screening, they think of mammography, and for good reason. Mammography remains the foundation of breast cancer screening. It is widely available, relatively affordable, and highly effective. But even mammography has evolved. Modern 3D mammography, also called tomosynthesis, gives a much more detailed view than traditional 2D imaging. For many women, especially those with dense breasts, 3D mammography may improve cancer detection while reducing unnecessary callbacks. But mammography is not the only tool available. MRI has become one of the most powerful technologies for women at high risk. MRI doesn't just look at structure, it also evaluates how tissue behaves and how blood flows. That allows MRI to detect cancers that mammograms may miss. For women with genetic mutations, very dense breasts, or significantly elevated risk, MRI can greatly improve detection rates. However, more testing is not always better. And that brings us to one of the most important concepts in screening: false positives. A false positive happens when an imaging test shows something suspicious that turns out not to be cancer. That can lead to more scans, biopsies, anxiety, lost sleep, and stress. These are real consequences, and they have to be taken seriously. This is where personalized medicine becomes essential. Some women are willing to accept more false positives if it means maximizing cancer detection. Others prefer a more conservative approach. Neither choice is automatically right or wrong. It depends on risk, preferences, and values. The future of breast cancer screening is not simply more screening. It is smarter screening. It is about matching the right technology to the right woman at the right time. So when should screening begin? For many average-risk women, starting annual mammography around age 40 remains a very reasonable approach. But women at higher risk may benefit from earlier screening, sometimes in their 30s, and in some high-risk cases even earlier. That's why understanding your risk matters so much. Risk should guide timing, not age alone. Now let's widen the conversation, because breast cancer prevention is not just about imaging. Lifestyle matters. Physical activity matters. Body composition matters. Alcohol intake matters. Metabolic health matters. Sleep matters. Inflammation matters. Screening helps find cancer early, but healthy living may help reduce the risk in the first place. Both matter. Neither replaces the other. What excites me most is where we're heading. Artificial intelligence is already helping radiologists. Advanced risk models are becoming more personalized. Genomics continues to evolve. Wearable technology is giving us new insights into health behaviors. The future may include highly individualized screening pathways based on genetics, imaging, biomarkers, and lifestyle data. The era of precision prevention is arriving. So where does that leave us? If you remember only a few things from today, remember these. Know your risk. Understand your family history. Learn your breast density. Use modern risk assessment tools. Choose the right imaging strategy. Stay consistent with screening. And don't assume that average recommendations automatically apply to you, because breast cancer screening should not be passive, it should be intentional, personalized, and proactive. Breast cancer remains one of the most common cancers affecting women, but it is also one of the cancers where early detection can make the biggest difference. The goal is not simply more testing. The goal is the right testing, at the right time, for the right person. I'm Dr. Yende, this is OXYZEN Health Intelligence, and I'll leave you with one question. If you are a woman, or if you have a mother, sister, daughter, wife, or friend you care about, do you know her breast cancer risk profile? Not just her age, not just her family history, but her actual risk? Because understanding that answer could be one of the most important health decisions you ever make. Thank you for watching. I'll see you in the next episode.